Good afternoon, everyone. Welcome to our webinar. Incompass Michigan has a long-standing partnership with MIOSHA. Before we begin, I wanted to let you know that we have received a fiscal year 2021 Consultation, Education, and Training Grant Award from MIOSHA. We're grateful for their support as we continue to provide health and safety training opportunities to community rehabilitation organizations across the state. Supporting our members and maintaining a safe and healthy work environment for staff and persons served is a priority for this association, as you know, and we appreciate the opportunity also to present today's webinar. And I'm pleased to introduce Sean Egan, who serves as Deputy Director for Labor at the Department of Labor and Economic Opportunity, where he oversees MIOSHA, Workers' Disability Compensation Agency, the Bureau of Employment Relations, and the Wage and Hour Division. In June, Governor Gretchen Whitmer also appointed Mr. Egan to serve as Director of COVID-19 Workplace Safety, where he's responsible for helping ensure that as businesses across the state reopen under the My Safe Start plan, they enact strict safety measures to protect the health and safety of employees and customers. Welcome, Sean, and thank you for joining us this afternoon.
Thanks so much for having me. I failed to touch base with Malcolm earlier because I can talk forever. So I'm going to run through a presentation overview and then open it up to Q&A. I'll try to be as quick and as efficient as I can. So I will talk really fast. I can tell you that like you're navigating with things changing, I have some slides with way too many words on them. I'm not going to read them to you. I'm going to run through those concepts pretty broadly. I will share the slides afterwards, so you'll have links or anything else that you need there. And we will try to navigate that way. I know that you've had the opportunity with the MIOSHA grants, with partnerships with MIOSHA, and recently with some MIOSHA experts to have these types of discussions. Amaya, if you could allow me to share my screen. So I know that you've been engaged in this process, and I think that's wonderful. I've been a lifelong advocate for working people, and that certainly includes people with disabilities. I was on the board at the United Way in the West Side for many years and worked with a lot of great organizations doing a lot of great work to support people as they navigate whatever it is they need to participate in our society as strongly as they can. And I can't tell you how invaluable I think the work that you do is, and support everything that you do. So I'm glad to have the opportunity to talk with you all today. And I did look at the membership list because I'm very good friends with Dick Bolkowski, and Dave Bolkowski, who both do this work on the West Side, but I didn't see them on your membership list. Certainly the Hope Network over on our side of the world is pretty big and had a lot of interactions with them. But today I'm going to talk about the workplace safety emergency rules and some of the state emphasis programs. Now you have to navigate this in multiple ways. First off, the services you provide to your constituent base or those people with needs, you have obligations there. You are employers, so you have obligations in that sense as well. And you provide direct services to people. So you're trying to navigate it all, and I get that, and we get that, and we're happy to be here for questions, consultations, whatever you need to help navigate through this COVID crisis. Just a real quick primer. I won't belabor you with this because I know that you know this, but there's been a few things throughout this crisis that have remained absolutely static. So when you're thinking through the MIOSHA Emergency Rules or the DHHS Epidemic Orders, they really center around these concepts of social distance, face coverings, and good hygiene. The virus itself is largely believed to spread through the large respiratory droplets and aerosols we create when we talk, sing, cough, sneeze, you name it. And those face coverings really help pull that right back close to us. We know that large respiratory droplets can travel about 6 feet. That changes a little bit in the winter, and there's a couple of reasons I'll mention for that. But and then those aerosols we create, which are finer mist particle, can hang around a little bit longer. And if we wear those face coverings, we believe we can cut transmission if we're both wearing them by about 70%. And that's huge to make sure that we're containing the virus. Now, there are certain things as employers that you need to do, which include daily health screenings. And another challenge with this virus is about 40% of the spread is going to come from those that are asymptomatic. They're never going to get sick. They're never going to feel sick, but they're going to be able to transfer the virus. And they're going to make it through those daily health screenings because they're just not going to have symptoms. So those face coverings, that distance, the hygiene, those things just become that much more critical to help us to contain the spread of COVID. And we're tracking a lot of workplace outbreaks. And I take out some of the data, so I don't include schools, colleges, childcare, nursing homes, detention centers, because those are going to be a lot of non-employee associated outbreaks. There's still a lot of employees impacted there, and many of you might be in this situation where you're providing training or other tools where you have non-employees that could be part of an outbreak. But just to focus in on what's happening out there in workplaces across the state of Michigan, from the week of the 23rd, this was posted, and that week prior, that'll be updated today. So I'll have a new slide probably tomorrow on this, but DHHS is continuing to track about 267 ongoing workplace outbreaks, 93 or so associated with manufacturing and construction, 40 in offices. And in that week prior, there were 105 new outbreaks reported, 15 in offices, 43 manufacturing, construction, 6 in retail, 17 in restaurants and bars. So as you can see, it's significant and it's across different types of workplaces. And just for reference, in that week, we had about 10 reported at social gatherings. So when we think about the news and where we see these things are happening, the workplace is significant. Now, that also tells us that workplaces are doing what they need to be doing. They're finding the outbreaks and they're reporting the outbreaks. It's hard for DHHS to really track in on those social gatherings because you're counting on people to tell you where they were and what they were doing. Workplaces are reporting, so that's one of the reasons we're seeing those there. And when we have cases at 506 per million and a positivity rate at 13.5%, that means the virus is going to get into the workplace. So if you haven't had an outbreak, prepare for an outbreak and be prepared on what to do about that, because it's everywhere. And like I mentioned, the workplace is contributing, but it's the community that's bringing it in there. So we really have to be diligent in all these things that we're expecting. So on October 14th, MIOSHA issued emergency rules. Now I know all summer employers were working from the executive orders. We really tried for consistency here across what you were doing in the executive orders to what you have to do in the emergency rules. One thing I noticed on Encompass's website was when you were listing out the COVID-19 resources, you had listed on October 14th the DHHS epidemic order, but you didn't have the emergency rules. And these are two separate obligations. The MIOSHA covers just about every workplace in Michigan, and that's going to have most of your workplace obligations to protect your employees. And then you're going to need to layer in those other DHHS requirements. And we do work closely with them. Those are going to be more variable as COVID changes. When we issued emergency rules from MIOSHA, we expect those to be pretty consistent and static for at least the next 6 months. So part of those rules, I'll explain in a minute, are things that you have to have, and then layer in for your particular type of work environment, anything that DHHS might have, because those are going to be more variable. So I'm going to just real quickly, we've launched 2 state emphasis programs. We did 2 over the summer. One was for hospitals, one was for retail, bars, restaurants, those types of places. And given the outbreak numbers, we've launched 3 more recently that are going to focus in on office environments, manufacturing environments, and construction environments. And what these are just a proactive enforcement tool that MIOSHA investigators are going to randomly select workplaces out of these categories and just stop in. They'll announce themselves to management, so they're not just going to wander around, and they're going to do an inspection on site. And some of the things they're looking for are things you already know that you already have in place for the most part. You have to have that preparedness and response plan. We have a template for low and medium risk workplaces, which is just about every workplace in Michigan, barring hospitals, nursing homes, and some of those other types of establishments where you're giving direct medical care. You're going to have COVID coordinators. That does not need to be a manager. You can do it by department. This is just your eyes on the ground to make sure that the COVID protocols are being adhered to. You have to be doing those daily health screenings. And if you're, there's a few ways to do those, but they have to include a questionnaire. And I always suggest using the My Symptoms app if you're not familiar with it. It's a free app created by U of M and DHHS that does the daily health screening questions for you. As an employer, you just sign up, you'll get an employer code. Your employees will connect to that code and use their smartphone, tablet, desktop, you name it, answer those questions. It'll let them know if they flagged. It'll also give you as an employer real-time access to that dashboard on who's taken it, who hasn't, who flagged, who hasn't, and those types of things, so that you can try to keep COVID right out of the workplace altogether, because that is the #1 tool in your arsenal, is to mitigate, to completely get that risk out of the workplace. You have to be doing training for your employees. You're going to have to do some record keeping on the daily health screenings and trainings. And then I'm going to touch on a remote work policy, because we've gotten a lot of questions on that one. Just a quick primer, there's face coverings included in the MIOSHA rules. I know that DHHS has some as well. There's some overlap there. As I mentioned, these are more static. Layer in the variables, because DHHSs are actually tighter right now for some types of workplaces. But same as what you were used to on the emergency orders, employers provide a non-medical grade face covering that can be cloth, it can be a non-medical grade surgical mask, and you can allow employees to provide their own as long as they're good. And CDC is not recommending those ones with the easy breathe valves, because they will actually allow that virus, those large respiratory droplets, to just go in and out. So you really want to watch out for those. But you're requiring those in workplaces where you can't maintain that 6 feet. If you can't maintain at least 3 feet, then you'll want to consider adding a face shield. So it's a cloth face covering plus a face shield. As I mentioned, the face coverings are about 70% effective. So those face shields are intended to try to help capture that other 30%, as well as in workplaces where you may not be wearing safety glasses, covering your eyes, because that's another exposure point for you, and why hygiene is critical. As you touch the surface, you touch your eyes, nose, or mouth, you can contaminate yourself. And then you're going to always wear face coverings in shared spaces, and that's going to include in-person meetings, restrooms, hallways, any place where people can sort of congregate without intention. And then there are additional face coverings in the emergency rules for some specific industries, and some of you may fall into these depending on what level of service you're giving or providing. So I just not going to read through them, but just to be aware that there's some in there to check for, make sure you're familiar with. And then we do have a rule that requires employers to create a policy prohibiting in-person work for employees to the extent that their work activities can feasibly be completed remotely. So obviously that rule alone gives rise to a lot of questions, and we've been fielding them. That is a written policy. It can be right in your preparedness and response plan. You should include at least in your determination information which shows which positions, classifications must report for in-person work and why that cannot be performed remotely. Now, MIOSHA fully understands that even in an office setting, and this remote work policy is designed for those folks that don't do physical labor, right? So if you're a construction worker, manufacturing worker, you're going to be on site. This is for those office type settings, more so for those office type settings where some of those functions can be performed remotely. But MIOSHA fully understands that even in an office environment, there are people that may need to report to work. Could be data sensitivity issues, somebody's got to get the mail. There's certain things that have to be done, and they get that. You just need to put that in a policy on why they need to be there. So one of the questions we've gotten is, what about collaboration? That's not going to work during the COVID crisis. Just being more collaborative is not a good reason to have people in the office, but there are other people that might need to be there. And MIOSHA's, if they got a complaint that you're requiring people to come in person and that can be done remotely, they're going to ask you for this policy, and that's what they're going to look at. If you if you've done that, you should be fine. Just make sure that it's thoughtful and reasoned. And I know that all of you are doing that. We get it. Our community numbers are through the roof. Anything we can do to avoid congregation is what we need to be trying to do. So that would include trying to get to that remote work to the maximum extent that you can. And just quickly, I want to touch on quarantine and isolation. I know that some of you might work in certain critical industries, and there are some differences, but in general, if somebody has COVID, either through symptoms or a diagnosis, a confirmed test, or they're suspected, which includes those close contacts, you need to keep them out of the workplace, or you need to get them out of the workplace. And this C here, assigning known or suspected cases to work alone, is not intended to allow people back into the workplace necessarily. It just recognizes that if I were to have COVID and be asymptomatic and you can let me work remotely, that's fine. If I have symptoms and I feel like I can work and you're going to let me work remotely, That's fine. You can do those kinds of things. You just worked it out with your employee or your employer, depending on what situation you're in. That's okay, but you shouldn't be letting them back into the workplace. And then a quarantine is different than isolation. Quarantine is for close contacts, somebody that was within 6 feet or more, or less, I'm sorry, for 15 minutes or more with a known case. They need to be quarantined for 14 days. And at least right now, I know we've heard news about this possibly changing. A negative test during that 14-day period does not get them out of quarantine. And that's because symptoms can develop at any time during that incubation period. Now, if they have symptoms or they have a confirmed test, then it's 10 days. If they have symptoms, then their fever has to go away and their symptoms have to be getting better without medication. And then in certain medical and critical infrastructure industries, there are some differences to the quarantine piece. Medical has its own unique rules, so I won't get too detailed on those. I can take some questions if people have them. But that's going to be pretty specific to direct medical care with COVID patients and that type of thing. Then all the materials you ever wanted are available at our michigan.gov COVID workplace safety website. This is where all of our updates are. We have guidelines posted for every industry that was named in an executive order. We've kept that going. There is some format difference between what executive orders looked like versus emergency rules. I would encourage you to understand the rules, but go to these guidelines to help you navigate those. They do look different. Pretty much everything that was in the executive order, with the exception of some certain more variable pieces or some pieces that weren't really enforceable anyway, are different. But the guidelines will really help you get in there. And then we're continuing to update an FAQ on the rules themselves that we get. So that link is right there on that COVID workplace safety website. It's got great answers. I definitely encourage you to check there. If that doesn't get you where you need to be, MIOSHA created a hotline in May, 855-SAFE-C19 for COVID workplace safety questions. The wait time is almost gone up to a minute at one point, but it's back down to about 30 seconds, but that gets you right into the MIOSHA experts. So you can definitely go in there and ask questions about the rules, your workplace, get more specific about what you need. And if you need it as an employer, they will get you over to the consultation side. MIOSHA has a wonderful consultation team. Employees, if it's necessary, they will get them over to the complaint side. We have consultation programs at MIOSHA you can use. We launched an ambassador program. This is designed more for retail, bars, restaurants, those places that don't deal with MIOSHA very much and have what we call a heightened community transmission risk, which just means the general public's coming in and you have less control over the virus possibly being in there. And then we have our regular consultation program, which is available to any employer. They can do that on the phone. Sometimes they can come on site if you need them. They'll work with you on plan components, and you can request a consultation right from the MIOSHA website at the Consultation, Education, and Training link. Same group that Todd mentioned awarded the grant. So they're a great bunch of people that will help you out as much as they can. And then we have links to a lot of other information there. If you're looking for PPE or something, the Michigan Economic Development Corp has a Peer Michigan Business Connect platform, which connects Michigan businesses that are creating these things to buyers. That includes sanitizer, face coverings, plastic barriers, you name it. If you're a manufacturer doing that, you can connect your Michigan business through that platform as well. We have a link there to the My Symptoms app if you need help with that daily health screening. And then the newer, more recently launched My COVID Alert app uses cell technology to identify when you may have come within 6 feet of somebody with known COVID, encouraging Michiganders to sign up for that. That'll help a lot with that contact tracing piece. And it does track, cell technology tracks it. It doesn't have your personal information, but it would let you know if you're within 6 feet for 15 minutes or more. And then with that, as I mentioned, I can talk all day, but I will stop there for questions. I know that you've had more detailed MIOSHA support. I can definitely get into the details. Happy to do whatever you need.
Thank you, Sean. Really appreciate it. You're right. You have a gift. That was an incredible amount of information compressed into a very short time frame. Well done, and thank you. Quick note of follow-up on our website. While the cover page does have the link that you referenced, a quick click on Resources for Reopening tab will take folks to our November 18th info alert, which lets everybody know about the ambassador program, the state emphasis program, COVID-19 workplace safety guides, and the MIOSHA emergency rules, as well as the sample COVID-19 preparedness and response plan. So
Awesome. Thanks, Todd. I appreciate you guys reposting that. I think I apologize if I implied you weren't doing it. I just noticed that. And next time I'll get deeper into the site.
We want to make sure folks get good information. I also wanted to thank you for spending time on the remote work policy. Like MIOSHA, that's an area where we've received many questions, and based on the content of the slide, what we've been disseminating is consistent with that. So I appreciate you reinforcing that. If there are no other questions from the group, I did have one fairly high level question. You mentioned the kind of 6-month expected time frame for the emergency rules, but I'm wondering what your perspective is on the longer term impact of the pandemic on workplace safety and health for Michigan employers.
So I think that is a great question, Todd. I think the way the Administrative Procedures Act works in Michigan is that you issue an emergency rule for 6 months. When you get toward that deadline, you could potentially issue for another 6 months. I think we will, as we get closer, we'll take a look at what's happening with COVID. At this stage in the game, I don't want to speculate too much, but I don't anticipate COVID being gone anytime soon. I think we have that shimmer of light with the vaccines out there, but as we're all watching the news, we know that certain groups will get inoculated first. It looks like with both of the major ones so far, there's at least 2 doses, so that's going to take more time. My advice to every employer is that I think that we're looking at all of these mitigation strategies well into 2021, so let's just get comfortable with them. We don't know and won't know for some time if you could still shed the virus, even if you were vaccinated. I did see one doctor say that, and we just won't know until we get further down the road that you might still be able to carry and shed. So mitigation strategies, I think, like I said, let's just settle in. This is what it's going to be in the workplace. Hopefully our numbers come down and DHHS can lighten up on some of the more variable pieces I mentioned. Most of these mitigation tools in the MIOSHA rules, in my opinion, are very, very easy. The remote work being a challenge, some of those getting a little more complicated, but by and large, providing a face covering, requiring people to wear it, clean up after yourself, make sure you're doing cleaning. Those are pretty simple concepts to just have in place. I think one of the things that's highlighted for me is that, while I wouldn't anticipate us going this deep on just normal things like the flu and the cold, these give us strategies to really help our workplaces all the way around. Right. And we should be considering how, as employers, that maybe these are tools we want to use moving forward. When we get to cold and flu season, we all, in the past, we've all talked about it. Come November, we're going to wipe out a third of our office for a couple of weeks because the flu's going around, or a cold, or whatever else is happening. So I think what we're going to get more in tune with, just being better about it. I don't want to speculate too much further on how often these types of viruses might happen. What we've heard for a long time from scientists, that as the climate continues to warm, that we may see these things more frequently. So one of the things for me too is, while we want to get past the pandemic, I don't think you ever want to forget about it. So these might be things that we're educating on, teaching on, thinking about moving forward as well, just to have in place. A lot of businesses have fallback plans, preparedness plans for all types of exigent circumstances. And this should just be another one moving forward, probably for just good practice. I hope that answered the question. I don't know.
Thank you. Thank you. No, it is very helpful. And we do have a question in the Q&A. Are you able to access that, or would you like me to read that?
You can read it, Todd.
On the remote work, if we have a few staff that must go into the office at least a couple of days a week, must we also list what days they can go, or just who must go into the office at times?
Yeah, I don't think we would expect you to be extremely specific on which days they were going in, as in, Sean can only be there Tuesday and Thursday or something like that. But in your plan, just have that they will be going into the office on a couple of days a week. I think that's a great strategy. That's one that we're using in the state of Michigan as well, to make sure we don't have too many people there. Go in, get what you need, and get out. Your employees will need to do that daily health screening on those days that they're going in there. One question we get on remote work is that If you are completely remote, you're going to be in your house. You don't need to be necessarily doing that daily health screening. But if you're going to leave your house to go into the office, you need to do it. If you have field work on those days when you're doing the field work, you would need to do it, but just not all the time, for obvious reasons, right? The goal is to keep COVID out of the workplace. If you're not going in there, it's not really doing much for us. So there's not much call for it. So just enough detail to show that, they're going to have to go in a couple days a week. I would definitely encourage your employees to avoid, unless they need to, avoid doing it the same days. We know that we all are social beings, whether we admit it or not. I'm one that doesn't admit it. I claim I like to be alone, but we have seen, even in our own agencies and departments, those employees kind of like coordinating days. We just need to avoid that. With our community numbers so high, we know that the risk of transmission is just too great. So if they don't need to be there on the same day, try to encourage them to make sure they break it up.
Great. Thank you.
Hey, Todd, I have a question.
Sure.
Hi, Sean. Thanks for joining us today. This is John Smalley with Muchmore Harrington Smalley and Associates. Wearing a couple different hats. One is an employer, and then one is a parent of a bunch of kids in college that all came back from college for Thanksgiving here. We've had a couple kids with the COVID, and we've had a couple different responses. One being you need to test negative before you can come back. And the other one was just 10 days. And if you're symptom free, you're gone, which, that's fine, well and good. But as an employer with that liability, can you clarify if we need a negative test to come back or if it's just that 10 days or 14 days? So
Absolutely. The 10 days applies if you have symptoms, even if you don't get tested. If you have symptoms and you're confirmed, or if you're confirmed and never have symptoms, that's going to be your 10-day period. You do not need a negative test to return. The only thing with the non-symptomatic folks is just be mindful that they still have a little window that they potentially could develop. But the reason for that is that if you're confirmed to have COVID, your likelihood of developing symptoms, the window changes. Now, if you are a close contact, I was, within 6 feet for 15 minutes or more. Keep in mind that 15 minutes is, according to the CDC, cumulative over a 24-hour period. You're going to have to do that 14-day quarantine, and that's the one that a negative test will not get you out of, because the difference is that when you're confirmed, you have enough of the virus that you were confirmed, whereas when you were exposed and close, you may not be able to be confirmed until you develop enough viral load to actually show a sickness, right? So 14 days if you're within close contact, 10 days if you are confirmed.
Thank you.
One of the things, John, that leads me to another question is, it's 14 days on that quarantine from your last close contact. So think about somebody taking care of someone in their home. That 14-day period can actually become quite long, depending on what they're doing in their house. Now, the CDC does suggest that if you are able to isolate yourself in your house, for example, someone's on that end, you're on that end, you don't really get within 6 feet, even if they're sick and they don't necessarily need you, your 14-day would go from your last close contact. So if you're on your end of the house, it's 14 days from the last time you're within 6 feet. You'd really want to communicate with your employees to have a positive belief that that's happening for sure.
Yeah, the key is communication.
Yeah, absolutely. Always, right?
Yeah, exactly.
Thank you. I know we're pushing up the time here. I guess one more question in closing, Sean, if you have a moment. You had mentioned the vaccine and the kind of beacon of light that's providing to folks for a few months down the road. I'm wondering what your thoughts are on any kind of potential for an employer requirement to address vaccination in policy or procedure.
I've actually been looking at that, Todd, believe it or not. So I think what you'll find if you're, depending on the type of employer you are, you're going to find that it's complicated. At best, it's complicated on whether or not you can require that, to what extent. There are exceptions to requirements, which include religious beliefs or medical need. So I think there's going to be a lot of variables. Certainly those in the healthcare industry are going to have less, it's going to be more of a need for them to be vaccinated. for a lot of reasons. So it might be a little bit different in that case, but in general, I think it's possible, but there's challenges to it for sure. I wouldn't rush out and just write a policy saying we're requiring everybody to be vaccinated, because it's just not that simple.
Fair enough. Well, thank you again. This has been incredibly helpful. Appreciate you carving out the time, which I know is precious these days, a lot of competing demands for your time and expertise. So thank you again, Sean. Thanks to our partners at John and Malcolm at MHSA for helping to convene this conversation. And thanks to all of you for tuning in. Take care, everybody. Be well.